Each year, millions of people in America are prescribed a medicine for acute pain. Now, for the first time in over 20 years, the FDA has approved a non-opioid pain treatment that offers an effective and well-tolerated option without the addictive potential of opiates. Joining us today is Dr. Todd Bertosh, Chief Medical Officer for Pain Research at SynXL, Principal Investigator at SynXL Utah for Jornax, if I'm saying that right, Vertex Pharmaceuticals Acute Pain Steering Committee member. I'm saying a lot, doctor. He'll discuss the significance of this new medication and how it works and what it could mean for the future of acute pain management. Good morning, doctor. Again, how are you?
Good. Good morning. That was a mouthful, wasn't it?
Yes, sir, it was definitely. So, doctor, can you explain what acute pain is and who is affected by it?
Yeah, acute pain is usually defined as a pain that has a sudden onset and lasts less than 3 months. So a little different from chronic pain, which is defined as something that persists for longer than 3 months. So, some option or some possibilities of things that might lead to acute pain. You might think of surgeries, burns, broken bones, sports injuries, things like that. So it's a pretty universal experience. Probably most of the audience today has experienced some form of acute pain at some time in their life.
For those experiencing moderate to severe acute pain, are there any options that can help manage their condition?
There are, in fact, as you mentioned, for the first time in more than 20 years, the FDA has now approved a medication from a brand new class of medications. It's called Journavx. It acts in the peripheral nervous system, so it blocks the transmission of pain signals before they reach the brain. So the receptors that it acts on aren't in the brain, and so it doesn't have that same addictive potential that the opioids have. So a really exciting new potential option for the treatment of acute pain. It does have some side effects like most drugs do, some potential side effects that can cause itch, rash, muscle spasm, things like that. And there are some drug-drug interactions that are possible. So definitely patients should talk to their doctors and make sure that it's right for them, but a really exciting new development.
Now, who might benefit from Genethics?
Right now, it's approved for adults who are experiencing moderate to severe acute pain. That's what the FDA approval covers for now.
Now, why is this approval of this medicine so important right now?
Every year in the US, about 80 million people are prescribed something or receive something for acute pain. And about half of those prescriptions, about 40 million of those prescriptions, are opioids. A really surprisingly large percentage of those patients go on to develop opioid use disorder. Some studies suggest up to 85,000 patients a year will go on to develop that. So it is a really important factor in the opioid crisis. And so being able to limit the number of opioid prescriptions that we're writing and limit the amount of opioids that people are taking when they have acute pain, I think is a really crucial part of impacting the opioid crisis.
Now, where can our viewers go to learn more?
Yeah, they can go to the website. It's journavx.com. And of course, talk to your doctor. Their doctor might be as excited about this, new option as I am.
This speaking with Dr. Todd Bertosh. Thank you so much for joining on some morning blend. I've said a mouthful already, and eventually I'm going to get the word right. Jornavix. Am I saying it right?
That's correct, Journavx.
Jornavix. Doctor, thank you again for joining us on Morning Blend.
Thank you. Thanks for having me.